live on the world. That's great. So good morning and welcome. This is the Joint Standing Committee on Health Coverage Insurance and Financial Services. We have a number of work sessions planned for this morning, and we will be working our way through those. Let me do my best right now off the cuff to come up with what our order of operations this morning will be, because I know that there were a number of folks interested in that information. And honestly, Chair Tepler and I have just been in meetings nonstop since about 8:30 this morning. And so we hadn't had a chance to put together an order or a list for today. But I think what we'll do is to take up LD 522 first today. And then we will, so that one is dealing with financial services as opposed to with health coverage. Take that one up first, and then we will take up LD 441 and 665. And then we will take up 599 and 600. And then we will take up 541 as the last item of the day this morning, hopefully. And we may break at some point along the way because I think we just received the proposed amendment for 541, and I know I haven't had a chance to open it. So that's why I tucked it at the end of our work today in case we need to take a break and have a chance to peek at that amendment before we talk about it. Okay, so without further ado, I will start with committee introductions, starting with Representative Matheson.
Good morning, my name is Christy Matheson and I represent District 1 Kittery.
And Representative Quint.
I'm Tracy Quint. I represent House District 144, the Greater Holton area, including Weston.
Representative Connor.
Thank you, Madam Chair. Good morning, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Arford.
Thank you, Madam Chair. My name is Representative Poppy Arford. I represent District 49, which is the western part of Brunswick.
Representative Evans.
Thank you, Madam Chair. My name is Richard Evans. I represent House District 120, including Atkinson, Brownville, Dover Foxcroft, Medford, Milo, Orneville Township, and Lakeview Plantation.
Representative Blyer.
Thank you, Madam Chair. I'm Mark Blyer. I represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Representative Brooks.
Good morning. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
Representative Melrano.
Good morning. My name is Gina Melrano. I represent House District 62, which is part of Auburn.
Representative Morris.
Good morning. I'm Representative Joshua Morris. I represent House District 75, which is Turner, Leeds, and Livermore.
Representative Tepler.
Good morning. My name is Denise Tepler. I represent House District number 54, which is all of the town of Topsom, and I serve as House co-chair of the committee.
And I'm Senator Heather Sanborn, represent Senate District 28, which is half of Portland and half of Westbrook. And we're assisted today by our analyst, Colleen McCarthy-Reed, and our clerk, Christian Ritchie. And so we will start with LD 522. Colleen, take it away.
Thank you. LD 522 is an act to cap interest rates for consumer debt. You tabled the bill at your last work session to allow some additional time for the sponsor and others to meet to discuss some language that had been presented to the committee earlier, but have some chance for some additional thought and consideration into those proposed amendments. Senator Bennett did share a proposed amendment with the committee members yesterday that I distributed. I'm happy to share that. I'm not sure if Senator Bennett is here or not.
He's not going to be joining. Oh, actually, I don't know that. He might be here. I think he had other things going on.
Okay. Okay.
But so let's
Want me to
screen
share
share
that?
that amendment for a moment at least, to make sure we're all kind of on the same page, and you can kind of walk through what the sections do for us, Colleen.
Sure. I think everybody should be able to see the proposed amendment now up on the screen. And this is, as I understand it, this is suggested by Senator Bennett. From my understanding of the discussions with all the interested parties, I'm not sure that everybody is completely on board with this proposal. At least that's what Senator Bennett shared with me yesterday. But this is the language that he would like to put forward for the committee's consideration. It is intended to replace the bill. So this, there are several sections. One of the things that I would point out is that the original bill proposed to make some changes capping interest rates and making changes to the maximum fees that can be charged related to consumer loans. The proposal before you doesn't include those changes, so it would maintain the current provisions in statute related to interest rates and finance charges. But instead, in statute, several sections, as I understand it, sort of directed at some of the predatory loan practices that have been identified and prohibiting them. So those actions would be considered a violation of the Consumer Credit Code and would provide both some additional enforcement mechanisms for the Bureau of Consumer Credit Protection, but also provide some consumer protections in the sense that some of the language would declare loans made in violation of these provisions void and uncollectible from the consumer. So the first section is language that was shared with the committee previously, but it would add a provision that would prohibit entities that are covered by the Consumer Credit Code, subject to their regulation, would be prohibited from engaging in any device subterfuge or pretense to evade the requirements of the act, and it identifies certain practices, including but not limited to making loans disguised as a personal property sale and leaseback transaction, disguising loan proceeds as a cash rebate for the pretextual installment sale of goods or services, or making, offering, assisting, or arranging a debtor to obtain a loan with a greater rate of interest, consideration, or charge than is permitted by the article. And that refers back to the provisions of Title 9A. And then it also provides that any loan made in violation would be void and uncollectible as to any principal, fee, interest, or charge. It also would add in section 2 a provision that a person would be considered a lender subject to the requirements of the act, notwithstanding the fact that the person might purport to act as an agent, service provider, or in another capacity for an entity that's exempt from the act. And then it identifies certain actions. If the person holds, acquires, or maintains directly or indirectly the economic interest in the loan, if they market, broker, arrange, or facilitate the loan, or the totality of those circumstances indicate that the person is a lender and the transaction is structured to evade the requirements of the act. And then it sets forth some factors that can be considered that would weigh in favor of someone being considered a lender and subject to the act's provisions.
And Colleen, just to sort of help the committee as a shorthand, this is the rent-a-bank
yes, essentially, yep,
concept, right, of making sure that people can't evade our supervised lender requirements by kind of renting a front bank for them to operate through.
Yes.
Okay.
The third section makes some changes to the current law that makes clear that if someone has violated the provisions of the act, the debtor is not obligated to pay the loan. The current law referred to or would say that debtors were not obligated to pay any application fee, prepaid finance charge, or closing costs. And this would just say simply that the debtor is not obligated to pay the loan. So it broadens those protections for consumers. And then in section 4 of the proposed amendment, Also provides additional language that says if someone has violated the provisions of the act applying to their authority to make supervised loans, the lender would be prohibited from reporting information concerning the debt to a consumer reporting agency or referring that debt to a debt collector. And then lastly, to address some of the issues that were raised when the bill was first presented about the current interest rate caps in the statute, as well as the fees that are currently permitted. It would include language directing the Bureau of Consumer Credit Protection to conduct an analysis on the use by Maine consumers of short-term small dollar loans, survey the interest rate caps of other New England states, look at complaints from Maine consumers, and report back to the committee next session with any recommendations for legislation. So that's a quick overview of the proposed amendment. I do think there are some folks in the room, including the Superintendent of Consumer Credit Protection, Will Lund, who could answer some of the specific questions. I was not part of the specific discussions of pulling together this proposed amendment, but I believe Mr. Lund did have discussions with Senator Bennett and other interested parties.
Yep. Great. So the reason I look like I'm looking up to the ceiling is because I'm just going to pull up the amendment on my other screen.
I can keep sharing if you want. So.
No, I think it's helpful if you close it for the moment, but if folks do have two screens, it's, it'll be helpful to open it. So if you've got it
I have
handy,
it on mine
then
too, but yeah.
That works. So I think Representative Tepler, go ahead.
Thanks, Madam Chair. And thank you, Colleen, for the analysis. I guess I am curious whether there's a lot of verbiage in the first two parts of the bill. And I guess I have some concerns about the definitions of some of those things and whether or not we can reference other sections of the law to provide those definitions so that we don't end up with a whole lot of uncertainty around what we mean.
Are you referencing the first two sections of the amendment?
Yes, I am.
Okay. Let's ask Will Lund whether those terms are adequately defined in the statute, because this is in the context of 9A,
yes,
Section 2, which has a whole bunch of definitions in the statute. So let's bring in Will and we can ask his thoughts.
It may only require a reference to the definitions in 9A.
Well, those apply
they would
automatically.
already apply. Yeah.
Okay, thank you.
Good morning, Superintendent Lund. So the question that Chair Tepler asked is, I think, whether there are any words in sections 1 and 2 of the amendment that are undefined in section 9A that we should look at defining.
I'm comfortable with the language as presented here. There is no definite. First of all, you are correct. This is the proposal is to insert this language right in the middle of the Consumer Credit Code into Article 2. So any definitions in here that are found elsewhere would be incorporated in effect by reference. Phrases like device, subterfuge, or pretense are not defined specifically, but I think they have a common sense meaning. The idea here is that when unscrupulous lenders are charged with lending either without a license or in violation of a state's law, a common defense is that this wasn't really a loan, that it was a sale and a leaseback or something else, in effect a subterfuge. And I think that is the effort, is to say that we understand what you might try to say, but the consumer still has borrowed money and still owes a lot of interest back. And so we're going to call that a loan.
Great. So I think that the amendment is really great as to the first 4 sections of it. And I want to, on the section 5, which is the loan study, Superintendent, I wanted to ask you, whether you have the authority to actually, rather than just surveying other states and looking at complaints, whether you have the authority to actually put questionnaires out to the regulated lenders themselves that do small dollar loans and ask them about their practices in terms of what fees they're charging, particularly thinking about the provision that we have in our statute that provides for a cap on fees in lieu of interest rates, and whether and who is using that statute and what effect it has. And so I guess the question is whether your current authority allows us to compel those regulated lenders to respond to you.
We have compliance examination authority currently over licensed lenders. There are 6 or 7 companies that make small dollar loans and have a current main license, and we either have that information or have access to it. I don't think it is confidential or proprietary because those are the costs that would be set forth in a contract that a consumer would sign. So the simple answer is yes.
Okay, so if we revised this proposed amendment to include a provision that asks you to collect this information directly from the lenders themselves, in addition to looking at complaints and other things, you have the authority to do such a study. Is that right?
Yes, I'm happy to have that language added if you'd like.
Great. So I'm interested in doing that, and I want to also potentially call out directly within the parameters of this study 2201 section 6, which is that provision of what the maximum finance charges can be in lieu of interest, and because I want to understand what impact those have on the effective interest rate of small dollar loans and of the creation of the debt trap that we know can come into play. And so I guess a couple more thoughts on the language of the study. Wondering if where it says include a survey of interest rate cap laws in other New England states, we might want to look at something a bit broader than that. So it's interest rate and fee caps, right? So that it encompasses that subsection 6, as well as, potential rules or limitations regarding churning of loans. So I think that Vermont has a provision that requires like a cooling off period between loans, so that you can't just take out another one the next week. So I want to make sure our language is broad enough that it isn't just about interest rate caps, but about all of the sorts of regulations that other states might have on these small dollar loans in order to prevent the debt trap. So those are some of my thoughts. Other members of the committee, Representative Tepler, I see your hand is up. Is that a new hand? Okay, go ahead.
Yes, it is. Thank you, Madam Chair. And thank you for being here, Mr. Lund. I would like to make sure that in your survey that in terms of information about consumers and their experiences, that we're not just turning to the complaints that come into your bureau, but instead that there's also an opportunity to speak to some of the nonprofit organizations that help to defend low-income folks against bankruptcy. And just that there's some outreach to consumer oriented organizations.
There, Representative Tepler, in number 3 in section 5, there is a reference to surveying credit counselors. I think that was an effort to get at what you are asking, but I'm certainly happy to have that clarified further along the lines you are suggesting.
Thank you, Superintendent. I really appreciate that.
And then the last piece that I wanted to bring up is the timing of the study. The amendment that's been presented to us suggests that the study be returned on March 1st, 2022, which is really way too late for us in a short session, which is what we'll be in next year. So I'm wondering, Superintendent Lund, if we could put in a deadline of November 1st, 2021, or December 1st, 2021, so that we have plenty of time to report out a bill prior to our January session.
Absolutely. We will work within the time frame set by the committee. December 1 is a doable process.
Okay, great. Representative Connor, go ahead.
Thank you, Madam Chair. I was just curious. We keep talking about the small money loans, but I'm curious to know if this will also impact hard money lenders, such as real estate investors that can't go through normal channels. If they have to go to a hard money lender that usually charges a little higher interest rate for that money, is this going to affect that industry as well, or are we only focusing on the smaller payday loan type entities in that industry?
I'm happy to respond if you'd like, Senator
Go
Sandberg.
Go ahead, Superintendent.
The entirety of the Consumer Credit Code and Truth in Lending at the state and federal level are limited to what are called consumer transactions. That means the purpose of the loan is for personal, family, or household use. So true investment loans are outside the Consumer Credit Code. When I talk with commercial lenders, I say that the only rule about commercial lending is that there are no rules. That's the only rule. So this, for investment purposes, these changes would not involve hard money lending to build a house and on spec and to sell it, that sort of thing. It would have the potential to impact. We have over the years, in effect, caught some folks in Western Maine doing consumer lending, either straight consumer lending and hoping not to get caught, or telling consumers if they want money for their house to form a corporation and they'll loan them money under the pretense of it being a commercial loan. But the simple answer to your question is most hard money lending is commercial in nature and would not be directly impacted by this.
Thank you, Madam Chair.
Mm-hmm. That was a great question. Thanks, Representative Connor. I will also note that the way we've amended, or the proposed amendment we have before us, doesn't probably wouldn't impact those hard money loans in any case, because it doesn't change interest rates or cap interest rates or cap fees, frankly, at this point. So, okay. Are there additional questions from the committee for the superintendent? All right, seeing none, is there any additional discussion about the bill? Okay, Representative Connor, go ahead.
Thank you, Madam Chair. Sorry, I just wanted to make a statement, if I may.
Sure.
So I'm originally opposed to this bill as a military member, and I'm sure Representative Evans can attest to this as well. Traveling the entire country, you go to every military base and you're going to see probably 6 different payday lenders outside the gates to those bases. And as a young, dumb military member myself, I've used these services and I knew what I was getting into. I read the fine print. I saw, the loan that I was getting, I was going to pay back probably double, if not triple. That was a choice that I made. That was my personal responsibility. And so I knew what I was getting into. And I just want to make sure that I don't want to get into the habit of legislating out any personal responsibility. I know that I know what goes on. I know a lot of people think this is unscrupulous. And for some people, this is the only, sort of funding that they can get if they're in a pinch. And my fear is that if we legislate this and these businesses go out of business because we're handcuffing them, I'm curious to know where these people would go. Where would those people go if they couldn't go to that quick, payday loan, if you will, to get that emergency funding? I get the debt trap. I get all of that. But at some point in time, when you sign on the dotted line, you know what the dollar amount is that you've got to pay back. And if you're not willing to do that, then don't sign on the dotted line. And so I just wanted to get that off my chest. That's something that has bothered me about this bill from the get-go. I understand its intent, and I don't want to see people in debt. But at the same time, I don't want to legislate out any personal responsibility for people. So I just wanted to make that statement.
So Representative Connor, can I ask you if your statement applies to the amendment or if your statement applies to the original bill? Because the amendment takes out anything that would do what you just said and instead protects folks from fraud and subterfuge and using of pretense that people wouldn't actually understand, and then provides that if loans are made in violation of this act, they wouldn't be collectible and they wouldn't be sent to a consumer reporting agency. So I actually think all of the parts of the bill that are related to what you just said are not in the bill anymore. And then we have a study which would really just provide us with information about to the extent to which things are happening in Maine specifically,
Right.
so that we have some real good local data. So I'm wondering if what you just said is indicative of how you would vote on this amendment, or if it was really just in response to the original concept.
It was a response to the original concept. In reading through the amendment, like you said, all of those concerns have been met. I'm fully in support of a study to get that data, but I just wanted to make sure I was on record for the original amendment. The original bill. But with the amendment, those things taken out, absolutely.
Okay, that's really helpful, and I appreciate that. Representative Tepler, go ahead. You're on mute.
Sorry, it sometimes takes 3 clicks to unmute, and unfortunately, also my phone is ringing right this moment. I'm very sorry. I just wanted to re-emphasize some of what you said, Senator Sanborn, and that is that in my mind, one of the biggest problems that we're facing is this problem that people don't know what they're signing, that there's some trickery involved, and that people are being charged fees and things that aren't clear in the interest rate that might be presented to them. So that I really want to see us take care of folks and allow them to have clarity when they're taking personal responsibility in accepting a loan.
Okay. Is there any further discussion? Representative Bleier.
Thank you, Madam Chair. I just, out of concern a little bit, I just found that this particular session, a lot of the bills that we've had and we've had public hearings on have come back with amendments that have changed the bill in the design of the original bill. And so I know that in the past we've had amendments, but I just feel this year that not that I'm against this amendment, but just find that a lot of the amendments that we are getting with a lot of the bills that we are going through this year are changing the original purpose of the bill. And so that's a concern to me. I think that, if we're going to have public hearings on bills, the amendments should be put forth before we start having public hearings so that public could have an opportunity to have comments on what we're trying to do. So just want to put that out there.
Okay. Understood. I think it happens every session, to be honest, but certainly we've had a few of them lately and are having the same experience in my other committee. And I think it may be a product of us not being in the halls together to look at drafts ahead of time. But it does happen every session as well, which is why we do things like table and have a second work session, so everybody really does have a chance. And I think that's kind of where we're at with this one. Representative Connor, go ahead.
Thank you, Madam Chair. Yeah, along those lines, I was just curious, are any of the stakeholders or anybody else in the queue that can that can give us their thoughts on this amendment change, or do we know? Has anybody had a chance to see this and speak to it other than the department?
Let's see. Someone's hand just went up. Senator Bennett could potentially speak to that, and he is here, so we'll bring him in because I know that he did speak with a number of folks about it. Senator Bennett, welcome. If you can hear us, you can go ahead and respond.
Thank you. It took me a few clicks to get through. First of all, thank you to the committee for your thoughtfulness with respect to this bill. And yeah, I heard the comments, and they're all legitimate. This is a thorny issue, and there's a lot of different moving pieces. And I presented this bill originally to solve this issue of these interest rates and fees. And I've learned a lot, honestly. And I've been informed by a lot of interaction with various stakeholders. I spent the better part of this past week actually after the committee's original work session of reaching out. We had a meeting a couple of days ago involving all the stakeholders. We had some pretty in-depth discussions that involved not only Superintendent Lund, but also folks from the Maine Equal Justice Partners, from the Maine Bankers Association. I've talked with Bruce Garrity, representing the car dealers who have concerns about the original bill as well. Had discussions with national experts, had discussions with One Maine, who is a supervised lender of installment loans for higher risk installment loans for Mainers. They're a national group. And we've had lots of vigorous conversation, and I think it's fair to say that the amendment before you comes out of that. We took it as far as we could, but we realized that what's holding us back is really a lack of information about some of what I call the dark corners of this lending business. And some of that, by its nature, being dark, is hard to tease out. But we thought we could do a better job with a focused study on that, find out and organize at least what we know and what is knowable for Maine consumers. And then, the committee next year can take a harder look. The elements that are included, we're all agreed to. There's the OCC provision relating to rent-a-bank, et cetera, that may get triggered in coming months, depending on federal action. There's the other provisions that came out, the sort of heightened enforcement provisions in 3 and 4, which come out of the conversations I had with Superintendent Lund, that also were reviewed by the stakeholder group. And so we kind of pushed the issue forward as far as we could, but resisted putting a lot of the meat of the issue before the committee, because we just, for me, I just didn't know enough. And I felt like that we should gather that information, and then the committee and I and the rest of the legislature can make a better informed decision next year if we wish to move forward with more dramatic action. Hope that answers the question.
Representative Tepler.
Thank you, Madam Chair. And thank you very much for being here, Senator Bennett. I just want to point out to some members of the committee that your amendment was actually to some extent in response to the public hearing. So at the public hearing, we heard from a lot of stakeholders that there were problems with the bill, and you as the sponsor then proceeded to make an amendment to the bill in response to the public hearing. So I think that we need to think about that, and actually we hope that sponsors will respond to a public hearing with changes to a bill. So I am not offended in this case by an amendment being presented after the public hearing.
If I may reply, Madam Chair, thank you so much. But I do plead guilty to Representative Blyer's charge, which is that the original bill, I came to the committee may recall, I came to you with a wholesale amendment the day of the public hearing, for which I apologized a lot. Then, and this is not the way sausage should be made, and Representative Blyer's got a great point about that. I'll try not to be a repeat offender myself. And I think we can all try to learn, because I agree with the point that public hearings should have a purpose. I don't like to spring things on people, none of us do, and but I really, it's for whatever causes. I appreciate your forbearance, really, all of you, and dealing with multiple versions of this.
Thank you, Senator Bennett. I had forgotten about your initial sin.
All right. Great. So is there any additional conversation on the committee, generally speaking? All right. Let's have Senator Bennett go back into our attendee group, and I will move ought to pass as amended, but with the descriptive changes to the study that I talked with Superintendent Lund about, that I think Colleen was taking notes on. And we'll review the specifics of those changes during language review, so everybody will have a chance to take a peek at the real words. But I think conceptually, Superintendent Lund and Colleen both had a handle on what those were about. Representative Connor?
I was going to second your motion, Madam Chair.
Wonderful, thank you. Is there discussion on the motion? Representative Tepler?
Thank you, Madam Chair. I also wanted to include the changes to the section about outreach to consumer credit counselors, and beyond that to some other consumer folks.
Yep.
Thank you.
Yep. That was meant to be captured within the discussion about the study. So we'll get the clarity around the study for language review. Is there any further discussion? All right, seeing none, the clerk will call the roll.
Representative Quinn.
Yes.
Representative Quinn, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart, absent. Senator Brenner. Senator Brenner, absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 11 yes, 2 absent.
Okay. Great. So with that, let's move on to, we're going to review 4 bills now that kind of fall under the rubric, I think, of the mandate review provision. So Colleen, if you want to do just a brief kind of overview. I don't think we have to go too in depth because we have talked about it and mentioned it a few times with the committee, but we do have a pretty new committee. So we'll talk about mandate review briefly, and then we'll take up the 2 dental bills first.
Okay, great. So I did have a chance to send out some of this information to you yesterday, but as Senator Sanborn said, this is the first opportunity for the committee to discuss proposed mandated benefit bills as a group. And although you have had sort of targeted proposals that included mandates in some of your earlier discussions of LD1 and the bill related to coverage for nurse anesthetists, which was a repeat of a legislation from last session. But in terms of new proposals, I just wanted to give you this overview information because mandates do trigger a provision in the insurance code for further review and evaluation by the Bureau of Insurance. And it makes sense for you to be aware of that process, and it may impact some of your decision making as you discuss the bills later this morning and later this session. But a mandated benefit provision generally is a statutory requirement that health insurance coverage be provided for specific health services, specific diseases or conditions, or for services rendered by certain providers of healthcare services. And that's a definition that's included in the insurance code in the provision that triggers sort of the further review of these proposals. There is also something known as a mandated offer, which would be a statutory requirement that insurance companies offer coverage for a specific benefit to its policyholders. But with a mandated offer, it's the policyholder's decision whether to include the benefit in the purchased policy, and the cost of those benefits would be borne by those who purchase the benefit, as opposed to a mandated benefit, which is included in all policies that are sold. So the costs of that mandated benefit are spread across all of the individuals that are purchasing insurance. There is a list in current law of mandated benefits and mandated offers that are required in current law. That's on the Bureau of Insurance website, and I shared that link with you. But in terms of the special process that I mentioned that's in statute, there is a provision in the insurance code at section 2752, which requires that all mandated benefit proposals must be reviewed and evaluated by the Bureau of Insurance before they are enacted. So the statute sets forth a process that the Committee of Jurisdiction would hold a public hearing on a proposal and determine the level of support for the proposal among the committee members. If a majority of the committee supports the proposal, the committee has authority to refer that bill or to the Bureau of Insurance for further review. And as a practice, if the committee is doing this during a session or asks the review to be done during the course of a session, the committee would delay the work session on the proposal until that review and evaluation is completed by the Bureau of Insurance. The statute lays out some specific criteria that the Bureau takes a look at. They're asked to assess the social and financial impact of mandating the benefit, the medical efficacy of mandating the benefit, and the effects of balancing the social, financial, and medical efficacy considerations. And at the back of the sort of overview, I provided a copy of one of the most recent reviews that the Bureau of Insurance completed in the 129th legislature on a proposal that related to requiring health insurance coverage for treatment of childhood panda infections. That was a piece of legislation that the committee did not move forward for enactment, but used the evaluation developed by the Bureau of Insurance as part of their deliberations. The last thing just to remind you of globally is that our state mandated benefit laws only apply to health insurers that do business in the state and to multiple employer welfare arrangements by statute. But our laws, if they move forward, do not apply to self-insured health plans that are exempt under ERISA. They would not apply to publicly funded plans like Medicaid, Medicare, including both Medicare Supplement and Medicare Advantage plans, or to plans that provide coverage for military families, veterans, or to the health insurance plan for federal employees. I would note, though, that there is a provision in the statute that governs the group health plan for state employees that does require the state employee plan to comply with any mandated benefits that are enacted in Title 24A. So I don't think I'll go any further. I did include in the overview for you, the language of the statute. And again, you can see here the copy of the report that the Bureau of Insurance prepares. One thing I would note about the process is that the Bureau of Insurance in their letters to the committee about these proposals has indicated that typically a mandate review, if it is requested by the Bureau of Insurance, takes about 8 weeks to complete. They do contract with the consultant to help them and assist them in preparing the report. And the cost generally per report, including both the consultant, work of the consultant and the staff time of the Bureau of Insurance, is approximately $15,000 per review. The Bureau uses their allocated funds to support the cost of the study. And then in terms of timing, I think if the committee is interested in moving any of those forward, just keep in mind that it takes roughly 8 weeks for each review to be completed. And the Bureau of Insurance has indicated that they could complete 2 to 4 reviews over the next 6 months to a year. So that's something to keep in mind sort of generally. The last thing I would mention is that while the statute does require that mandated benefit proposals undergo the review and evaluation by the Bureau of Insurance, the legislature does have authority to make an exemption from the statutory requirement, and has in the past with certain pieces of legislation included language when a bill is enacted that would exempt the proposal from further review and evaluation by the Bureau of Insurance. The provisions in LD1 are an example of related to coverage of COVID-19 testing and vaccines as something where the committee opted to include that language exempting the proposal from further review. I'm happy to answer any questions generally. If not, I can sort of pull up the chart of all of the proposals and we can start talking about the individual bills for today's work session.
Are there questions? All right, seeing none, let's pull up the chart.
And you mentioned you wanted to start with LD 441?
Yeah.
Okay.
We'll start with Representative Brooks's bill.
Yep.
441.
So I think everybody can see this. I'll try to make it a little bit.
Yeah, make it a little bit larger.
Does that work? So what I did for purposes of today's work session, and this has sort of worked in the past for the committee, is to kind of group them all together in a chart form so you can see that there are a number of bills that the committee is going to be considering today and later this session that by definition, and that's the statute I just referenced, LD 2752, would fall into the definition of what would be considered a mandated health insurance benefit proposal. So this chart identifies the 4 bills that you're going to talk about today, and some additional bills that have been printed but not have had their public hearings yet are included on this chart. And then the chart also includes some bill titles that I've identified as potentially including a mandate only by virtue of the title of the bill, which is difficult to do because you don't know what actually is in these bills. They could be printed and not include a mandate. And then there are other bills that could have a different title that once they're printed would trigger this provision in section 2752. So at the end of the chart, there are a few bill titles that I've included as well. But LD 441, as Senator Sanborn mentioned, sponsored by Representative Brooks, is an act to expand adult dental health insurance coverage. There's 2 parts to the bill, but part A of the bill includes the mandate, and it would require health insurance carriers to provide coverage for comprehensive dental services, would apply to policies and contracts issued or renewed on or after January 1 of 2022. Part B of the bill would require the MHDO to develop and maintain a database of dentists that provide dental care to main care members and post that information on a publicly accessible website. A couple of comments related to this proposal. One is that the committee did consider a similar proposal in the 129th legislature, also sponsored by Representative Brooks. That was LD 519. And a majority of the committee at that time recommended the bill move forward to the Bureau of Insurance for a review and evaluation. But because of the delay or the in the legislature's work due to COVID, and the fact that the 129th legislature did not come back and complete that work on that bill, that's why I think LD 441 has been reintroduced. There are currently requirements under the ACA for pediatric dental benefits to be included in the essential health benefits package. So there are some health plans that include pediatric dental benefits as part of their qualified health plans. And then there are some, and then through the marketplace, but then there also are standalone benefit plans for pediatric dental benefits that are also permitted under the ACA. There are no specific requirements for adult dental benefits under state or federal law as a mandate. You did have a lot of testimony at the public hearing about the availability of standalone coverage for dental care. So consider, as you're thinking about this bill, the interplay between the existing market and any expansion of dental benefits as part of qualified health plans as proposed in LD 441. Another thing to keep in mind is the potential cost to the state for defraying any costs of benefits that go beyond the essential health benefits. Pursuant to the ACA, the state may be required to defray any additional subsidy costs for qualified health plans. Another cost consideration is whether or not the bill would trigger any increased health insurance premiums, and if there might be an impact on the state employee plan. The second piece really to keep in mind is that Part B of the bill does not relate at all to a mandated health benefit proposal. So you may want to consider that separately because it does not relate to private coverage. I guess I'll stop there, and I'm happy to answer any questions. I think you wanted to go individually, right? And talk about them rather than talk about LD 665. So I'll stop there. Thanks.
So, so with regard to LD 441, okay. So with regard to LD 441, it does have two pieces. So I was hoping, Colleen, that you might be able to zero in on the second piece for us and bring us up to speed on whether there are provider databases. This is something we've talked about a bit, a couple of times now. So if you could circle back to that piece, that would be great.
Yep, I'm happy to. And I did share some of this information with the committee by email with some questions about the extent to which there may be existing resources related to information about dentists that accept main care patients. And while there isn't, it doesn't appear that there's any directory that lists individual dentists currently, there are some existing resources available to individuals that are covered by main care in terms of availability of dental services. There are two things I wanted to bring to your attention. One is the Maine CDC's oral health program does publish an annual directory that was recently updated in January of dental clinics and healthcare centers in Maine that assist clients who may not have a dental home or a regular dentist in obtaining dental care, including those that are covered by main care. And then secondly, which I think one of the folks who testified at the public hearing on the bill referred to an existing resource put forward by the Partnership for Children's Oral Health. They include on their website what they call the Maine Dental Access Map. And that resource provides information for Mainers who might have urgent or routine oral healthcare needs who don't have a dental home. And they identify those for people. And if you go on that website, it sort of gives you a map of the state of Maine and just little, figures or icons that you can click on throughout the state that shows you, like with a little pin, where you can access resources at health clinics and other dental clinics. And as I mentioned, they don't specifically list private dentists that would accept main care patients, but they do provide resources for folks.
Okay. Is there a committee discussion? Let's focus on that second part of the bill first. Representative Tepler.
Thank you, Madam Chair. So what I heard from Colleen's analysis was that there are resources or lists of resources, but there is no updated list of private dentists throughout the state who accept main care. I guess a question might be, how difficult is it to maintain that kind of a list?
I feel like we might be a little bit out of our depth in answering that, just because we're over here in the insurance committee as opposed to the HHS committee. But Colleen, do you want to try and weigh in?
I think there are a number of things that impact, the participation of dentists in providing main care services. And I think committee members might be aware of sort of a global rate reimbursement study that the Department of Health and Human Services is conducting, and has been looking at reimbursement rates. And one of the areas, as I understand it, that has been identified as sort of having rates that the legislature or the main care program might want to address is in the dental area of dental care. So I know that may be, if reimbursement rates are improved, that may improve the availability of dental services for main care members by private dentists. I think the difficulty perhaps in providing listing of individual dentists is just related to the difficulty about updating that directory information and making sure that it is accurate. I know the committee has had discussions before about provider directories for health insurance carriers and the need to provide that information and update that. And there's been discussions sort of generally about the challenges by health insurance carriers about keeping that information regularly updated. So I think maybe some of the same concerns relate to the issue of a directory of private dentists, in terms of making sure that it's updated. The CDC's website and some of the information that you can see that Consumers for Affordable Healthcare, for instance, shares about dental resources seems to recommend that if an individual is seeking a dentist or a dental home, they generally refer or provide the 1-800 number for main care to call to provide some assistance when they're talking about individual dentists. But they do, as I mentioned, provide contact information for some of the freestanding clinics and other health centers that are available.
And just so thanks, Representative Tepler. And just so I'm clear as to what we're talking about here, for the most part, main care covers just pediatric dental at this point, because Representative Gattin's bill didn't pass last year.
That was the other thing that I should mention. There are provisions or proposals being considered in the HHS committee to expand the availability of dental services to adults as sort of a companion to Representative Brooks's proposal. Her prior piece of legislation last session included both a main care piece and a private health insurance piece, but there was other legislation in the HHS committee in the 129th legislature, and it's my understanding that that also is being considered in the HHS committee this session, and Representative Connor may be able to provide more up-to-date information about where they are on that, on those proposals.
Representative Connor, have you guys heard those bills yet in HHS?
I apologize. I am not going to lie. I was reading something and I did not hear that last part, Colleen. Can you repeat that?
The question was about whether adult dental coverage in main care has been heard yet in HHS this year.
I don't believe I've seen that one just yet.
Yeah, I didn't think it had come up for a hearing yet. So Karen Lee Harrington is in our meeting and she has her hand up. I think she could probably answer the question that Representative Tepler asked about how hard it would be to maintain such a database. So let's bring her in. Good morning, Ms. Harrington. Welcome. Do you have some insight for us on this provider database question?
Yes, good morning. So I just wanted to let you know that MHDO currently collects dental data from main care as well as from commercial payers. And effective January of this year, the board passed a new requirement where the data needs to be submitted with an indicator as to whether the provider is in the payer's network or out. So I think we will have the data to be able to indicate, and that would include main care is also sending that similar designation, whether a provider is, participating. So I think we probably could do it. And I'll just say this, we are creating a provider database as we talked about in LD 541. And it's starting with sort of the medical claims, focusing on behavioral health, but we are going to expand that to our dental data as well. So I'm just saying, I think, we could help with the data that we are collecting and what we plan on doing over the next year or so.
Do you need statutory authority to do that, or is it already in your work plan? And therefore you can just go ahead and do it?
Yeah, I don't think we need statutory language. We're doing it. So I'll just leave it at that.
Okay, perfect. That's helpful. Okay. Thank you for joining us. Does anybody have any additional questions or comments on that section of 422? Representative Brooks. You're on mute.
No, I think that's great that the Maine Health Data Organization has been proactive in creating that plan to get more information about the dental care in for among dentists and dental clinics. So that's really good.
Great. Okay. So turning now to the first part of the bill, which is the mandate for comprehensive dental coverage in private insurance. I guess I'll kick off the discussion by just saying I have some grave concerns about whether the unintended consequence of such a mandate might be to make healthcare less affordable as opposed to making dental care more affordable. And I think while I completely agree that the mouth is part of the body, we find ourselves in a terrible position where the way that the paradigm is set up today, it would be very difficult for us to simply meld dental insurance into a healthcare premium and then still ensure that, for example, 23-year-olds or 27-year-olds who are losing their health insurance after school or after their parents can no longer insure them are able to actually access health insurance. And then I guess I also have a grave concerns about the value of dental insurance itself as an insurance product. And so I want to make sure that we address those concerns before forcing everybody basically to pay for it if they want to have health insurance. So that's sort of where I am coming at this bill from. I will say procedurally, Colleen noted that we generally delay the work session until the mandate studies are complete. I think procedurally what we tend to do instead actually is to table all the mandate bills until the end of the session, then decide which studies we want to go forward over the summer with, and then end up carrying those bills over and picking them back up in the second session. So I think, your paragraph is probably correct in some prior legislatures, Colleen, but in my experience, we've never actually passed a mandate review bill in the same session we asked for the study in.
It's rare. It hasn't been that happen very often recently, but it has in the past. But yeah, you're right. Usually it means usually it does mean a carryover because of the timing. This session, it probably would mean, you need to give them the 8 weeks. And so it would be a while.
Right. So are there other comments on Part A of the bill? Representative Morris.
Yes, thank you, Madam Chair. I would concur with you. I don't want to add dental coverage as a mandate under the insurance code. I think because right now, too, the other piece is that dental coverage is something that is not sold on open enrollment. You can get it year round. It's always open enrollment, I should say. I also would have concerns about the competitive pricing of it if it was just having to be rolled into their regular health insurance versus having it be a separate insurance that they can purchase from another entity like Delta Dental. So I mean, I'm fine if you wanted to table it for a study, but I probably would not support a study at the end of the session either.
Yep. Representative Brooks.
Yes, I'm concerned about potential unintended consequences as well. If the person is enrolled in a high deductible plan, and if the services aren't covered with first dollar benefits, it would, high deductible plans would make somebody maybe not pursue that treatment or have to meet a high deductible before they can get the care they need. I would like to table the bill and have a more complete discussion when we have all the mandated bills side by side. But I wait for any more discussion before making a motion.
Thank you, Representative Brooks. Representative Evans.
Thank you, Madam Chair. I would tend to agree with what Representative Brooks just talked about. I think we should wait because there are quite a few unanswered questions and potentially some consequences that may not be favorable. So I'm in favor of table.
Okay. Representative Arford.
Yes, thank you, Madam Chair. First of all, I want to thank Representative Brooks for bringing this bill forward, although I do agree with your assessment that the best course of action is to table it at this point. I think it's an incredibly important issue, and people are going statewide without dental care because they can't afford it, and insurance is not available in an affordable, comprehensive manner. So I agree with your with the path that you have presented for us to go forward with this bill.
Okay. So at this point, unless there are any further hands, Representative Brooks, I'll entertain a motion.
I'll make a motion to table the bill.
Okay, is there a second? Representative Tepler has seconded the motion. And we don't need a roll call on this motion. All those in favor of tabling the bill? All right, it's unanimous of those present. Thanks, everybody. So next we will turn to the other dental bill that we had, which is LD 665. And we'll have Colleen walk us through her chart.
Couldn't figure out how to unmute myself because I was in a tiny window. Okay. So LD 665, this bill also relates to dental care. As drafted, the bill would require a health insurance plan to include medically necessary dental procedures that are the direct or indirect result of cancer treatments. One of the things that I think you may want to consider is thinking about amending the language of the bill as drafted, because the way that the bill is drafted, really it suggests that the requirements would apply only after receiving cancer treatment. And some of the testimony that you received at the public hearing was focused on dental treatment that's needed before someone can start cancer treatment. And a few of the dentists that testified focused on the need for individuals to have some pre-cancer treatment dental work done in order to minimize risks of infection. So that's something that I think if the committee is interested in addressing, I think the language of the bill would need to be amended. And then some of the things that the proponents who testified talked about was some fairly routine, potentially dental care that may or may not be covered if someone had available dental insurance. So there may be an issue, or consider to what extent coverage might be available under existing plans. I'm going to pull this up here. It's skipping too much. The next thing really, and what we touched upon in our prior discussion, is if the legislation does move forward, or if the committee asks the Bureau to conduct a review, they do look at, in addition to the medical efficacy, the social impact, they look at the financial impact. So I think the financial considerations are something that should be considered, not only to defray any costs of adding to the essential health benefits package, but any potential for increased costs to the state employee health plan. The other thing that I think I would mention just generally about the drafting of the legislation is, as it's drafted as well, it doesn't include a specific effective date or application date. And I think if the committee is interested in moving forward with enacting legislation, or even asking the Bureau of Insurance to conduct their review, a specific application date of January 1 of 2022 or later is helpful when they're doing the review and evaluation and sort of estimating the costs associated with the legislation. There also was a question at the public hearing about the extent to which other states may have addressed this issue, and I was not able to find any state statutes that have been enacted specifically related to this issue. The issue of Medicare and coverage of these types of procedures was also raised at the public hearing, and there is, if you do sort of a search of the resources about this issue, you will see some things come up about Medicare related to this, but nothing specific in other states related to private insurance coverage. So I guess I'll stop there, but I'm happy to answer any of your questions.
Thanks, Colleen. Are there questions specifically for Colleen? I have a number of questions that are not for Colleen. Okay, so, Representative Melrano, go ahead.
Thank you, Madam Chair. I'm sorry, I was just unclear as to whether Medicare covers these types of. No. Oh, okay.
No, they do not either. But there are some resources and news reports and other efforts at trying to raising the issue similar to what was talked about at the public hearing in relation to Medicare coverage, as well as the issue about private coverage raised by the proponents of this bill. So it is an issue that's been talked about on the Medicare front as well.
Thank you.
So my questions are kind of more, I think, for Ms. Pelletreau, Ms. Cook, or Ms. Ossenfort, who I see in our meeting, and are really about sort of trying to draw some bright lines for us about what types of medically necessary procedures are covered under health insurance and what are not when they are in fact medically necessary. So if any of the three of them would be willing to speak with us, if they could raise their hand, great. So let's bring Ms. Pelletreau into the meeting because I think we did specifically sort of preview those questions for her. So hopefully she's had a chance to collect some information for us. Good morning, Ms. Pelletreau.
Good morning, Catherine Pelletreau from the Maine Association of Health Plans. I'm willing to comment, but I don't have definitive answers for you. I have posed this question to our members and frankly have gotten mixed results back. I think that for the most part, although not universally, the the oral health or dental services associated with cancer treatments do tend to be covered. Now, I would call out cleanings because I did hear specifically that cleanings are not often covered, but that if somebody needs to have a tooth pulled or have an infection cleaned up, something to that effect, that would often be covered. On the matter of coverage prior prior to treatment, I think it's a little trickier, and I was not able to get as clear an answer. So I will say our plans are still looking into it. So the question is still open. I don't really have a lot definitively either way.
Okay, great. I mean, I think that may give us actually enough clarity or lack thereof to think that a mandate study might actually be the perfect vehicle for having the plans sort of sort that out and figure out where the coverage gaps would be, because in order to assess how much the mandate would cost, they have to figure out what parts aren't currently already part of the premiums, I guess, if that makes sense as a logical way of describing what we're looking for. Representative Tepler, go ahead.
Thank you, Madam Chair. And I just wanted to ask Ms. Peltro, so if you have had cancer treatment that affects your oral health, your whole lower jaw region, and your doctor says you must have regular cleanings to prevent infection or something, that still may not be covered?
Right.
I don't think so. I mean, that's really all I can say. I don't want to give anything more definitive than that. But my sense is that cleanings are not typically covered by a health insurer.
Yep, I think that's right. Okay. Thank you, Ms. Pelletro. Let's swap out Ms. Pelletro for Ms. Cook, who also raised her hand and might have information, at least with regard to CHO. Good morning, Ms. Cook.
Good morning. I don't have a complete picture right at the moment, but I did get confirmation that we cover extractions pre-treatment for sure when those are necessary. So when those are the issues, I did not get any information yet about just a basic cleaning. But we thought for sure the extractions, and I'm trying to get confirmation. I think infections are typically covered as medically necessary treatment, whether they're in your mouth or they're anywhere else in your body. And so that was the clarity I could get in this amount of time, and they're still working on it. So thank you for the question.
Okay, let's give Ms. Ossenfort the chance to just round out the crew here as well. She just raised her hand, so. We'll get the anthem perspective as well. Good morning, Ms. Ossenfort.
Good morning. Thank you, Senator Sanborn, Representative Tepler, and members of the committee. Chris Ossenfort with Anthem Blue Cross and Blue Shield. I don't have much to add to what Catherine or Kim said. As you noted, Senator, it's hard to establish a bright line. I reached out to one of our medical directors, said there are unique circumstances where some of these services would be covered, but it's kind of hard to say in a vacuum what they might be. And I tend to agree that probably regular cleanings post-treatment probably aren't covered because dental insurance would be available to cover that types of services. So we would just ask the committee, if you're interested in a mandate study, sort of give us some of the parameters that you would like us to look at so that we can provide you with meaningful information. So thank you.
Yep, thanks. Okay, so anybody have any additional questions for anybody who's in our attendee list, I guess? Okay, so with that, I want to kind of see if I can help chart up. Do you have additional questions, Representative Tepler? Okay, go ahead.
Thank you, Madam Chair. And it's not a question for anyone in the attendees list. It's just a question we might need answered before we go to mandate review. And that is if we could get that oncologist who spoke to us back at some point to outline more clearly what is needed pre and post cancer treatment for his patients, that would be very helpful.
Right. So I wanted to chart a path forward that's sort of similar to what you just suggested, but here's what I would suggest. Number one, I think it would be helpful to have two provisions in the bill that could be mandate studied sort of together but separately. So one is about pre-treatment and one is about post cancer services. And so crafting the language of the bill so that there were those two separate sections rather than just adding them into one section. And then I think we maybe get a 2-for-1 from the Insurance Bureau because it would be a single mandate review, but they would break the data into 2 parts for us. The other thing I was going to suggest is that we actually have the insurers and the dentists, whichever oncologists or dental oncologists or cancer survivor dentists might want to be part of a little bit of a working group on what the language might need to be clear, so that the parameters of the mandate review are clear. And we've got some time because I expect this bill to be tabled and that we would look at it with all of the mandate reviews together. And so I guess I would ask that the stakeholders, by whom I think I mean the folks who testified on the bill one way or the other, might help us get some language clarity into the bill before we vote it out to mandate review, or before we sort of send it to mandate review after it's been tabled to join up with the others. Colleen, does that make sense?
Sure. Yeah, no, that makes sense. I mean, I think typically, especially if we're considering changing the language in the letter requesting the review from the Bureau of Insurance, will often provide a new amendment or describe the changes that we want the Bureau of Insurance to look at. So the more we can refine it, as you've talked about it, I think the better. And I'm happy to sort of work with the parties to develop some language around that. And then if and when the committee does decide to send it to a review, you can actually see what the language the Bureau would be asked to look at. Sure.
Yeah, I think that's the way to do it. And I think we've got enough expertise with, Ms. Pelletreau, Cook, Ossenfort, and then the 2 or 3 dentists that we had that testified, that we could really triangulate what we're talking about here so that the study is meaningful. Representative Tepler, go ahead.
Thank you, Madam Chair. I believe that one of the 2 people we heard from was actually an Augusta area oncologist, not a dentist. Yeah. And that the other person was a dentist who had herself been through cancer treatment. So we may need, I don't know, we may need to ask the sponsor to reach out to those folks to include them, but we may also need an additional resource or 2, perhaps from the Board of Medicine and the Board of Dental Practice. I don't know.
I think Angela Westhoff has it. Yeah, I think Angela Westhoff has those contacts, and she just dropped a note in the panelist chat to that effect.
Yeah.
Okay.
Yeah. Yeah. And we have contact information for everyone who testified in terms of email contact information. So my hope would be I would sort of start with putting a proposed language together, and then we go from there in terms of whether or not we need to meet, or we could do it through email.
Okay, so Dr. Baraby's actually an oral surgeon and not an oncologist. Right. So I do think maybe we need to find an oncologist.
Representative Evans, go ahead.
I think that going ahead with the study, you're gonna need somebody, I'm not so certain that you'll need an oncologist, but you probably should have an internist involved in something like this, because I think from the pre-treatment standpoint, that's going to be much more narrow than people who are actually in treatment or immediately thereafter. But I think that the three are going to be different.
Okay.
So,
Yeah, I don't think we need to overcomplicate this. I think we're just looking for a little bit more clarity around the words in this amendment. So I don't think we have to put together too complicated a group. And I think Ms. Westhoff can probably get us the resources from the provider community that we need in order to triangulate the issue with the insurers. And the medical directors from the insurance companies themselves would probably have some insight into where the coverage gaps currently exist as well, because they're the ones that do the denying. Okay. So with that plan in mind, I guess I would look to see if there's any further discussion before we have a tabling motion. All right, seeing none, I'll move to table. Is there a second? I see Representative Tepler has seconded, and no roll call is required for tabling motion. So all those in favor, please raise your physical hand in your box. Okay, Representative Arford. Okay, great. So it's unanimous of those present to table again, with the idea that we'll be picking up all of our mandates at once for disposal at the end of, or closer to the end of session. And next we will turn to LD 599 and we'll go back to Colleen.
Sure. So back to the chart. LD 599, you'll see at the bottom of the page here, as it's drafted, it would require insurance carriers to provide coverage and health plans for ultrasound services when a provider considers the procedure necessary during a physical or a preventive exam. The sponsor during the testimony at the hearing did seem to indicate that the intent was focused more on coverage for an ultrasound exam recommended following a mammogram. I did provide for the committee some of the links to the current statutory requirements related to screening mammograms. The current law does provide coverage for a screening mammogram on an annual basis for women aged 40 and older, including in the definition of what a screening mammogram is, also includes an additional radiologic procedure recommended by a provider when the results of an initial radiologic procedure are not definitive. So that is something that's required in the statute, although it doesn't specify the type of that additional procedure, being an ultrasound or other form of sort of specific to the type of radiology that's required. So one of the things to consider is whether or not the committee is interested in moving forward, if the language of the legislation should be amended to more specifically focus on the intent expressed by the sponsor. The other issue relates to the language in the bill that talks about when a provider considers the procedure necessary. And as we've just talked about, generally insurance coverage is provided for medically necessary services, which would include medically necessary ultrasound exams. And then last, another thing to consider is perhaps the extent to which the issue really is related to cost sharing or deductibles that might apply when a distinction is made between a service being a preventive service or a diagnostic service. And that's an issue that the committee has discussed before, not only with regard to these type of procedures, but other types of services covered under a health plan where there may be coverage for the initial screening or the preventive service, but if there's any follow-up diagnostic care, that triggers a different level of cost sharing under someone's health insurance plan. And then lastly, sort of the same kind of issues with the other mandated benefit proposals, that if this moves forward, the cost considerations, not only with regard to adding to the essential health benefits package, but any additional costs to the state employee health plan and to health insurance premiums generally. I'll stop there. I'll stop sharing. I'm happy. I saw a hand, I think. I'm happy to answer any questions. And then, you know, you did also get some information by email about more specific to the issue of dense breast tissue, which was raised at the public hearing, and the extent to which recommendations are made by providers about certain types of mammography that would be necessary for those women, and sort of the recommendations made in terms of medical guidelines for what recommendations are made to those women. I'm happy to stop there and answer any questions that you might have.
Representative Tepler, go ahead.
Thank you, Madam Chair. And thank you very much, Colleen. I think I had a conversation with the sponsor of this bill this morning, and the sponsor did not fully understand our limitations in regulating ERISA-based plans and overall large group plans in general. I think that the bill is essentially redundant of the coverage guarantees we have in current law, and so I'm really not in favor of proceeding with a mandate study for this bill.
Representative Evans.
Well, thank you, Madam Chair. I would have to agree. I think that the first part of Colleen's presentation clearly demonstrates that this is already covered. I don't think that we need to go beyond that. So, and even if there's a question of dense breasts, that's the radiologist will automatically, in just every situation, will do an ultrasound while the patient is there if deemed necessary. So you're not going to have people just, if you order an ultrasound first, then you shouldn't be doing that. You should be doing a screening mammogram. So I think that this is already taken care of.
Okay. Is there any additional conversation about the bill? Okay, I'm seeing none. I'm going to just move ought not to pass. And I see a second from Representative Matheson. All those in favor, oh, we have to call the roll. It's all ought not to pass. So the clerk will call the roll.
Representative Quinn.
Okay.
Representative Quinn, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melrano.
Yes.
Representative Melrano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart's absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
Great, thank you. All right, we're moving right along today, guys. Next one we're going to pick up is LD 600. I think we can pick this one up before we break, so let's do that. So LD 600, we'll have Colleen do her presentation.
Okay, so just really quickly, whoops, LD 600 is a little bit different in that it's not a mandated health insurance benefit, but it's a mandate of reimbursement for a category of provider. And the statutory definition of what's considered a mandated benefit proposal under the insurance code in terms of those proposals that would trigger a review by the Bureau of Insurance does include these types of mandated provider benefits, if you will. But they are treated differently under the ACA, and I'll get to that in a minute. But the bill before you, LD 600, would require insurance coverage for services performed by certified midwives that would be within their scope of practice. The current, it would apply to policies and contracts issued or renewed on or after October 1 of 2021 as it's drafted. Under our current law, services of certified nurse practitioners and certified nurse midwives are covered when the services are covered services and within their scope of practice. So what LD 600 does is just adds a reference to certified midwife in the current law, where it refers to the coverage for services of nurse practitioners and certified nurse midwives. And you had testimony at the public hearing that the scope of practice and the licensing requirements for certified midwives are on par with those of certified nurse midwives. So the bill would just simply recognize the ability of certified midwives to provide certain services within their scope of practice. And as I mentioned, under the ACA, under the federal law, mandated provider laws are not considered additions to essential benefits that would require the state to defray any additional costs. Further, the ACA prohibits discrimination against a provider based on a provider's license or certification to the extent the provider's acting within the scope of their license or certification under applicable state law. The provision in the ACA doesn't require carriers to accept all types of providers into their network or to govern specific reimbursement rates. And our state statute wouldn't direct the level of reimbursement for certified midwives or require that they accept them into a provider network. But if they are willing and participating members of a provider's network, the language of the statute would require their services to be covered and reimbursable under state law. So you may consider this because of the ACA's provisions. You may consider this bill worthy of not being referred to the Bureau of Insurance for a review and evaluation, although that's certainly something that the committee could do if you felt it was necessary. The last thing in terms of the drafting is I mentioned the bill as it's printed suggests an application date of October 1 of 2021. So I think if the committee moves forward, you might consider, and that's a typo there, consider an application date of January 1 of 2022, which is often the date that the committee has chosen in terms of putting new provisions that affect health insurance policies into effect. January is the date that you often would, the next January is the date you would often consider. So a future effective date of January might be better than October 1 of 2021. And I'll stop there. I'm happy to answer questions.
Thanks, Representative Evans. Go ahead.
Thank you, Madam Chair. I see we're not mandating any particular cost fee, and the services are essentially the same. I see no problems with parity in payment in this regard. So I would be in favor of supporting this.
And just to be clear, it's parity in coverage, not necessarily parity in payment, because the payment rates could actually be different. Yeah. Representative Morris, go ahead. You're on mute. You're still on mute.
Thank you. Sorry.
Yeah.
I would agree with what Representative Evans just said, and I would make a motion ought to pass.
Great. I'll second the motion. Is there further discussion?
Amendment,
Colleen's going to ask.
Yeah.
Colleen's going to ask whether you want the effective date to be January 1st, 2022. Representative Morris.
I think the effective date is fine in October. It's already being covered personally, unless you have a different opinion, but I personally think October is fine in this instance.
I see Chris Ossenfort's hand fly up in the virtual world. I'm going to recommend, although it's the more conservative approach, I'm going to recommend January 1, 2022 simply for bookkeeping purposes. I think that's when they redo all of their plans and their rates, and they file all of the different new forms. And so they don't file forms in the middle of the year, I think, is the issue.
Okay. That's fair enough.
Okay. So I'm going to suggest that as a friendly amendment. Senator Brenner, you had your hand up. Go ahead.
I was just going to suggest the amendment and just make a comment that parity in payment would be lovely, but maybe that's a different session.
Might be a different question. Yeah. Okay. Great. If I don't see any other hands up, so I'll ask the clerk to call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart's absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
Okay. We only have one bill left. We haven't looked at the amendment for it, and it is 5 minutes of noon, but we only have one bill left. So do we want to try and push through and just do it without having a break? Okay, let's do it.
I also have language review on the LD 631 if you want to do that as well. I don't think it'll take long, but just so
I don't
you
think
know.
that'll take long. Okay. I think we can just power through. Okay, let's pull up LD 541, and we do have Ms. Harrington here if we need her. So that's perfect. Great. And we already had a work session on this. Is that right, Colleen? And we were just waiting for the amendment.
We did, yes. We had one work session, and Representative Perry and the interested parties asked for some additional time. My understanding is that MHDO and the Department of Health and Human Services met with Representative Perry and worked out this proposed language for the committee's consideration. And that's what I'm pulled up for you here. It would incorporate 2 new sections to the bill. One would relate to the reporting of cancer incidence registry data to the MHDO, and it would require that information to be reported to MHDO. Recognizes that that data might include personally identifying medical or protected health information, that information would be reported in accordance with rules adopted by MHDO, and that the data would be assigned an identifier and integrated with other MHDO to protect that personally identifiable information. And then the language also further states that the release of that information would be done only in accordance with MHDO's rule on releasing data to the public, and generally that protects the release of personally identifiable information. The second piece relates to the reporting of data related to vital statistics to MHDO, and the same thing, it just adds sort of the statutory authorization for that reporting to the statutory provisions that govern the Vital Statistics Bureau, and it mirrors the same language I just talked about with the respect to sharing cancer incidence registry data. And then the last change, this makes a change to an existing provision in LD 541 as drafted, and you'll see the new language shown in red here, and really it just authorizes the adoption of joint rules by MHDO and DHHS with respect to this information. And then further states that the data reported is MHDO data and is confidential and protected pursuant to privacy and security measures. And again, reflects that the data would be released only in accordance with the MHDO's rule for releasing data to the public. I would note one with regard to this reference to making data confidential. This would trigger a further review by the Judiciary Committee before the bill is finally reported out, which we've talked about that with other pieces of legislation that the committees considered earlier this session. So if you do move forward with a favorable report on this legislation, it would undergo that additional review by the Judiciary Committee. I'll stop sharing. And as Senator Sanborn mentioned, Ms. Harrington from MHDO is here and can comment on the proposal. And I also did want to share that representative of the Department of Health and Human Services has indicated there before the work session that they are also in agreement with this language.
Representative Tepler.
Thank you, Madam Chair. I just wanted to make sure that Ms. Harrington was invited in and we could ask her briefly about whether this satisfies the problem of linking the data.
We can do it that if you want. It's her proposal. She's the one who forwarded it to us, so I assume it does satisfy her, but we can pull her in. Ms. Harrington, welcome back.
I think you were transitioning me to the status, so I couldn't hear what the question was.
Representative Tepler, go ahead.
Thank you, Madam Chair. And thank you, Ms. Harrington, for being here. I just wanted to be sure that this permitted the kind of data linking that was necessary for good evaluation of the data that you were concerned about.
Yes.
Thank you.
All right. For the record, she gave 2 thumbs up. All right. Great. So is there any further discussion on the bill? I'll move ought to pass as amended. And there's a second from Representative Tepler. Any further discussion on the motion? Seeing none, the clerk will call the roll.
Representative Quint.
Yes.
Representative Quint, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Millerano.
Yes.
Representative Millerano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart's absent. Senator Brenner.
Yes.
Senator Brenner, yes. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 12 yes, 1 absent.
Okay. Great. So Colleen, let's do language review.
Sure. I just wanted to do one quick language review of the bill that you oh gosh, I don't know why I won't. For some reason, it won't share my. I'm gonna have to open it back up. Sorry.
We can see the letter if that's what
Yeah, I
you're
know.
looking at.
I was trying to share the amendment and it wouldn't come up. So I wanted to share the amendment first. So you'll recall on, I think it was Tuesday, you had the discussion of LB 631, which is the act to provide funding for Maine's Health Insurance Consumer Assistance Program. And it was a divided report. And the majority and minority indicated that you wanted to send some further communication to the Appropriations Committee. But I wanted to share with you The majority report was ought to pass, but the minority report was ought to pass as amended. And I wanted to share that amendment with you, which would just change the funding source in the next 2 years of the biennium from a transfer of other special revenue balances from the Department of Professional and Financial Regulation to the general fund. So I really just marked up the legislation to show you what the changes would be. So it would take out the language directing the transfer and the appropriation to the Attorney General from other special revenue funds, and it would change it to the general fund. So the fiscal office is in the process of redrafting or re-preparing a new appropriations and allocations section that would designate that the funding to the Attorney General would come from the general fund in the same amount that was proposed in the original bill of $200,000. So I wanted to share that with you. And then also, as part of the committee's discussion, my understanding is that each of the committee members, or each side of the committee, the majority and the minority, wanted to communicate with the Appropriations Committee that while there was disagreement on the funding source, so for the next 2 years, that all of the members support the continued operation of the Consumer Assistance Program, and that on an ongoing basis, after this biennium, the committee would recommend, or the majority of the committee would recommend, that permanent ongoing funding for the program should come from the general fund. So this is a draft letter that would be sent representing the members who voted on the majority, just stating that while they supported and voted ought to pass to use other special revenue funds for the next 2 fiscal years on a permanent basis, you would recommend funding from the general fund. And then the second letter that I'll share really quickly is very similar. That would be sent from those members of the committee who voted on the majority report. Very similar, but just would say that they voted to amend the bill to use funding from the general fund in the next 2 years of the biennium, but like the majority, members of the committee would recommend ongoing funding from the general fund. So I
Colleen,
drafted it as 2 letters. It could be 1 letter. It could also be, the language could also be amended.
My question to Representative Morris would be whether they want their letter to be directed toward their AFA representative, their leads on AFA, as opposed to the chairs.
Yes, I think that would make more sense.
Okay, and then it may make sense to just have like mutual CCs on both of them, so that the chairs and the leads get both.
Yep.
Okay, I think
Okay. That
each
makes
I had
sense.
suggested. Anybody have any other comments on this language review? All right, we have completed our work for this morning. I'm sorry I didn't pick a nicer day for us to be done at 12:06. But hopefully that helps folks catch up on whatever other backlog they may have. I know I have a very large one. So with that, we have completed our work. We have rescheduled all of the hearings that were scheduled for next Tuesday, Wednesday. And those, I don't think those notices have all gone out yet, but I think they'll all go out soon if they haven't all gone out already.
And we do plan to meet
Representative
Thursday next week at 10.
Right. Christian says they are all out. I just didn't see them all. Okay, great. Representative Morris, go ahead.
Yeah, I just had a quick question for Colleen on LDs 352 and 443. My 2 bills. Have you had a chance to do the language on those yet? Or when might we see those?
I don't think there was any language on either of those. The fiscal office has them and is doing the fiscal review. So as soon as I get that back, they could be reported out. If I'm recalling, I think it was straight ought to pass, ought not to pass on those.
Yes. Yeah. I just wanted to make sure because I hadn't seen them and I didn't know when we.
Yep.
But
Yep.
your explanation makes
So
sense.
yeah, the fiscal office, we didn't have the fiscal information originally when we on the original bill, and so it just needs to go back up for them for a further fiscal note only information. And as soon as I get the clearance from them about what that is, they can be reported out. I don't anticipate that they'll need a fiscal note only amendment, but they just need to sign off and then they'll go.
Okay, thank you.
Christy's got a friend. Okay, is there anyone else who has any questions? All right, seeing none,